Hello, everyone, and welcome to the final day of our course, The Pandemic, Science, and Society. We have a great last session planned today. Our speaker is Chancellor Andrew Martin. He is the Chancellor of Washington University in St. Louis and also a professor of political science and law. And of course, he is our leader as we navigate this pandemic as a campus community. Today, he's going to be talking to us about higher education and the COVID-19 pandemic. Welcome, Chancellor Martin.
Well, good afternoon. Thank you for inviting me to be here today to share with you a bit about the university's response to COVID-19 and the implications for higher education more generally. I do want to thank you, Professor Milich, and so many of the others who helped put this course together. It's really great to see so many students enrolled and engaged in this course. Just to give you a preview about what I'm going to talk about before we move to the Q&A. First, I just want to do a little bit of level setting about what happened at Washington University this spring. Then I'm going to talk about the values that we've been using throughout this process to guide university operations. I'll talk briefly about the university budget, and then we'll talk about fall planning and where we ended up, how we're here today. And finally, I'm going to give some preliminary thoughts about the implications on higher education more generally. So let's start at the beginning. We began tracking the SARS-CoV-2 virus and COVID-19 in late January. This had significant implications for students, faculty, and staff who were working or studying in China. And we brought those folks home at that point in time. If you recall, in late February, the outbreak in Europe began really heating up. And we needed to bring back study abroad students, initially from Italy, and then a few days later from France, then all of Europe, and ultimately we brought all of our study abroad students home from around the world. Throughout that time, we were having regular contact with colleagues at the medical school in the Division of Infectious Diseases and Public Health, including with Dr. Stephen Lawrence, who I think you've had a chance to meet in this course. On February 27th and 28th, we formally organized a crisis response structure to deal with COVID-19 here at WashU. We had one organization on the Danforth campus, one on the medical campus. Those two were both being supported by our Emergency Operations Center, which happens to be on the medical campus. And we were also coordinating with BJC Healthcare, who is our healthcare partner. We began at the time that we were bringing students back from study abroad. We started with rolling travel restrictions. Those began to be rolled out the last week of February and the first week of March. As I said, we started by pulling the study abroad students back from level 3 countries and all of Europe and then everywhere. These students, with the exception of 2, were able to return to their permanent residences. The two returned to our residences here at WashU. We do know that a small handful tested positive for COVID-19, and thankfully none of these students we brought home were hospitalized. On March 7th, we found there was the first case of COVID-19 in the state of Missouri, which happened to be in St. Louis County. This was actually an undergraduate student from another university who had just returned from a study abroad trip in Italy. That following weekend, we decided to act quickly. And we were in the unfortunate position that this was the weekend that started our spring break. We realized at the time that we had many of our students were in areas with significant community spread, and that it would be a great danger to the Washington University community and to the St. Louis community for students to return home from spring break. And so we began a process on Monday, March 9th, on Tuesday, March 10th, to ultimately we came to the announcement that rolled up on Wednesday, March 11th, where we told our students not to come home from spring break, but return to their residences. This was to say the least, a very unpopular decision at the time, but I think in retrospect was the right call. As I mentioned before, the desire here to protect the health and safety of the WashU community and the St. Louis community was paramount. And ultimately, we concluded at a moment when there wasn't a lot of community spread here in St. Louis, that would have been irresponsible to have thousands of students descend into St. Louis, even if they were just coming to pick up items and return home. The other thing that we did, for those of you who are returning students, on that Thursday, March 12th, we organized what we called the pack and ship operation for essential academic materials at our cost. That was planned in 2 days, on a Thursday or a Friday, and beginning the following Monday, we began sending essential items home to over 2,000 students. That same week, we also needed to look carefully at university operations. We started a process on Sunday, March 15th. We worked through the academic units on both campuses, and by March 23rd, we had moved to what we call alternative operations, only having people on either campus that were essential. There was research that needed to be wound down on both campuses other than COVID-19 research. It was a very complicated logistical challenge. My office actually closed at the end of business on Monday, March 16th. I've only returned to the office for a few afternoons a week beginning in July. On the medical campus in the middle of March, we began ratcheting down all non-essential clinical operations to prepare for a surge. That was an extraordinary effort led by our department chairs and the dean of the medical school. To put this all in context, the first COVID-19 death in the state of Missouri was on March 18th, fully a week after we decided to put our education mission online for the rest of the academic year. On March 20th, we started prepping the lofts in the night center for healthcare workers. This was at the request of our healthcare partner, BJC, who had a lot of employees who were on the front line who just weren't comfortable going home. We had the first person who moved into our housing on April 1st, and we housed and fed healthcare workers and other first responders until late June. March 23rd was our first day of alternative operations. That's the day that St. Louis City and County issued their stay-at-home order. These orders were extended on April 7th and were lifted in mid-May. March 30th, we announced a hiring freeze on Danforth campus in the CFU, following a similar move that the medical school had taken earlier in March. As I'm sure that the upper class students know, the abrupt end to on-campus learning was hard on the students, but especially those who experienced loss of income or housing displacement, along with the parents and guardians who might also have struggles to make ends meet. So we set up a crisis response fund. We set that fund up on April 1st. To date, we've received over $750,000 and have distributed those funds to over 700 students and staff and faculty. The student fund was reopened on September 1st, and we'll be reopening the fund for faculty and staff later this month. One of the paradoxes of what was happening at the time is here on the Danforth campus, we were ramping down, closing laboratories, teaching classes remotely, and having very, very few staff in the office. On the other side of the Forest Park, however, things were getting ramped up as we were preparing, along with the other healthcare providers in the region, for the COVID-19 surge. By the start of April, Danforth was on alternative operations, education was fully remote. There were a few hundred students, mostly international students, who were still living in our dormitories. And at that point at the medical school, we had about half of the usual patient census at the hospital, and we were not doing any elective procedures. So that sort of gets us up to the beginning of April. Let me pivot and talk a little bit about values. One of the things that we needed to do in March is to take a step back and really be explicit with ourselves, me to be explicit with the Board of Trustees about the values that we were using to make decisions. And let me outline what those values are. Right, the first was that the safety, security, and well-being of all people continues to be at the forefront. That's always been true at Washington University, and I think was important to re-articulate the value at the time. And so as we thought about it, every class that we held remotely, every time we checked in with a colleague or a student to see how they were doing, every event that we canceled, every dollar that we raised for the crisis response fund, every message that we wrote was all about health and safety. Second was to be explicit about our mission. You know, we are a community-grounded mission, and that mission involves education and research and patient care, all in service of the greater good. Third, our mission calls us to enhance lives, not just on campus, but also throughout the St. Louis region and around the world. And while we have many in the public health and the medical school who have been working on this pandemic from a global perspective, we've also devoted a significant portion of our attention to our role and impact here in St. Louis. Fourth, it was important for us to uplift the values of diversity, equity, and inclusion during this critical time. particularly as we learned and began to understand how this crisis was affecting individuals from varying backgrounds in so many different ways. A fifth value is one of accountability and transparency. This is important to my own understanding of leadership. And I think that we were probably even over communicating in the early days of this crisis, which I think was probably a good thing. What made this difficult from a leadership perspective is because there were lots of important questions that we didn't have the answers, or if we did have the answers, they were difficult answers to accept. And so we tried to lay our cards on the table as much as we could, recognizing the great deal of stress that members of our community were facing. Final value is the importance of stewardship and sustainability of the university's resources. The resources that we have in this community, both past and present, have been entrusted into our care, and it's our job to deploy those resources towards our mission: education, research, and patient care, not just for the current academic year, but for the future. So as we began to think through all the implications of closing the campus, in the Danforth campus the second week of March, as we began to pivot to planning, we put these values front and center in terms of our thinking. Next thing I want to talk about at a high level is the budget, and I'm happy to return and dig down into the weeds if that's something that's of interest to all of you. Of course, just like every other institution and just about any other person, COVID-19 has had profound financial implications. We were not immune to the financial implications of the pandemic. And so in early April, we needed to turn to our budget, not just the budget for the rest of the academic year, but also the budget for the academic year to come. Now, just to give you a little sense about how Washington University operates as a business, we have a fiscal year that begins on July 1st and ends on June 30th. And so we were at the very end of what we would call fiscal year 20 or FY20, and we were also preparing for fiscal 21. Now, to give you a sense about how the budget operates, so for the 6 Danforth schools, the primary revenue that comes into the school is tuition and our endowment payout. Each one of the schools is responsible for their own finances, and the expenses that the schools have shouldn't outpace their revenues. The medical school, on the other side of the park, their primary revenue source is patient care through the faculty practice plan, as well as through funded research grants. In the middle of the university is something called the Central Fiscal Unit. My office is in the Central Fiscal Unit. So is the library, IT, HR, these sorts of things. Central Fiscal Unit is paid for by taxes. We call them prorations that are paid by the schools for central services. And so money comes to the center and then is used to provide those services. And finally, we have a set of auxiliaries. The auxiliaries are a variety of businesses that the university runs. Think housing, dining, bookstore, parking, all of those sorts of things. And in a typical year, we would want our auxiliaries to roughly break even. So the pandemic was not only poorly timed in terms of spring break, the pandemic was also poorly timed in terms of our budget process. In a usual year, we begin preparing the university budget in late fall. And by early March, the budgets for the coming year are approved and then ultimately go to the Board of Trustees for approval. We, in fact, were done with our fiscal 21 budgets by early March, and unfortunately had to throw those budgets in the trash and do the process again in 6 weeks that started the first week of April. Now, if I take a step back, different colleges and universities are in very different situations. Some don't have a medical school. And so colleges and universities without a medical school didn't suffer a loss in clinical revenue like we did. That, of course, would be not so bad in fiscal 20, but present challenges in fiscal 21. We do not own our hospitals. The hospitals where our physicians practice are run by BJC Healthcare, a separate entity that is closely partnered with us here at Washington University. But there are many universities that own their own hospitals and healthcare systems. And so they got a double whammy on the healthcare side. We have a great Division III athletic program. Universities that have Division I athletic programs, particularly at the Power 5 conferences, lost television revenue and ticket sales. We would guess maybe $100, $150 million in revenue that they won't see in their athletic program. And of course, the NCAA took a huge loss because of the inability to host March Madness last spring. On April 20th, I communicated to the university community about our financial situation. At the time, our academic hospitals had hundreds of empty beds. In fact, at the very peak, we were running about a 50% census at Barnes Jewish Hospitals. Our clinics were seeing fewer than 60% of the patients. We were providing critical and emergent care, but that was it. The financial impact of these higher expenses unique to the pandemic and lower revenues from lost volume created operating losses with revenues off by about $60 million in just the first month over on the medical school. This loss continued for some time until we were able to pivot back towards normal operations. In fiscal 20, so the last quarter of last fiscal year, we were projecting a revenue loss of $150 million for the medical school. Now on the Danforth campus, we didn't have any operating losses, but we did have some significant one-time costs of approximately $25 million to help us get through the COVID-19 pandemic. Now to give you some context on those numbers, last fiscal year we had a budget where we had about $2.6 billion of revenue in the medical school, about $1.5 billion of which is from clinical care, $700 million of revenue in the Danforth schools, and about $240 million in revenue in the central fiscal unit in the auxiliaries. And so for fiscal 20, the year that just ended on June 30th, the total university budget was $3.6 billion. Now, how did we deal with that $150 million shortfall at the medical school and the $25 million one-time charge for the Danforth campus? Well, we needed to make some moves in April. We instituted a hiring freeze, which is still in place on the Danforth campus, and there was a hiring freeze on the medical campus, which is being lifted now on October 1st. We had no merit increases, so everyone working at the university had a salary at most what they were paid in fiscal 20. We had 10 to 20% salary reductions in my pay and other senior leaders of the university. We also had compensation reductions, base compensation reductions for faculty and staff in the medical school. And we did furlough 2,000 employees across Washington University on both campuses. I'm pleased to report that over 90% of those employees were recalled at the end of July. In addition to those moves to deal with fiscal 20, we also had to re-prepare the budgets for fiscal 21. The original budget that we prepared had a total top-line revenue of $3.9 billion. The budget that I submitted and ultimately was approved by the board at the end of June had $3.4 billion in revenue. In other words, $500 million of revenue that we had expected to see that we didn't expect to see for fiscal 21. So how did we pay for this? Well, we paid for this in two ways. First, we cut about $350 million out of the budget. That was painful, but necessary. One of the things that we were forced to do is suspend the retirement contribution for all of our employees. We also were able to deploy about $150 million in cash reserves. These are rainy day funds held by the schools and the departments for a time just like this. The budget that we were able to take to the board was thankfully approved, and it was balanced. There's one issue, though, that's still unresolved, and that has to do with the one-time expenses due to COVID-19 for the Danforth campus for this fiscal year. With things including all the IT that we've had to install in our classrooms and everything else. We believe at this point that our best guess for those unbudgeted expenses is $48 million. And so we're working right now to try to find the resources in order to pay for that. Now let me pivot back to the timeline before I finish up and talk about our planning and the rationale for the fall. You know, March and April were an interesting time. I mean, March was crazy on both campuses as we prepared. Then in April on the medical campus, you know, we were dealing with the surge and all of the complications there having to do with taking care of patients that were presenting at the hospitals. Interestingly, on the Danforth campus, it was much more peaceful. Our faculty and staff were working, going 1,000 miles an hour, preparing to teach, to be able to continue our mission. But the campus itself was a ghost town. And from a leadership perspective, that's the point in which we needed to begin to work on two problems. The first problem was the budget, which I've already talked about, that process that started on April 6th. but so too was the plans for the fall. And that process also was kicked off on April 6th. Now, the first thing that we needed to talk about was our fall calendar. And we did make an announcement to have a phased approach to returning students to campus, with many students returning in mid-September. At the same time, many peer institutions around the country were announcing their plans, and they were doing exactly the opposite. They were trying to bring back students as soon as possible, some as early as the first week of August, such that the fall semester could end by Thanksgiving. So we didn't take that approach, and here's why. On balance, we felt that there were strong advantages to delaying the start of the semester and taking a slower, more measured approach to bringing students back to campus. Why is that? Well, bringing students back to campus gradually instead of all at once gives us a chance to begin the semester with reduced population density. Most of you are undergraduate students, but we've had students in the law school and the Brown School who have now just finished up their first 2 weeks on campus. This has allowed us to fully implement our public health measures and to see what works and maybe what doesn't work on our campus. The 3 extra weeks were also extremely valuable to us in monitoring the pandemic, getting a sense of what's happening out in the world, and perhaps most importantly, to see what was happening on other campuses, to see what we could learn from other universities and how to take what we've learned into the implementation here at WashU. Of course, the greater amount of time is giving our faculty additional time to provide flexible course materials. You know, we've never asked our faculty to teach in a hybrid format, or in some cases, a fully online format. And so the additional time, I think, was quite valuable to our faculty members as we prepared for the fall. I'm teaching a class in the fall, and I can tell you that this few extra weeks has been really helpful in terms of pulling all of my course materials together. Finally, as I'm sure you've heard, we had a saliva-based COVID-19 test in process, submitted to the FDA, and we wanted as much time as possible for us to get the regulatory approval to be able to use that test. So the bottom line for us is there was a little downside to waiting a bit longer to start the semester. We were committed to taking a deliberate, thoughtful approach, learning along the way to keep the health and well-being of our students, faculty, and staff as our highest priority. That time was so important given the complexity. Right on the other side of the ledger, of course, was Thanksgiving, which is something that many campuses were fixated on. And when I was talking with our public health and infectious disease colleagues back when we were making this decision in April, they were saying, Andrew, we don't know what public health is going to look like in May, let alone what it's going to look like in November. And so while our fall academic semester is starting late and will end much later than expected, I think the additional time on balance has been the right thing, at least for Washington University. A few weeks after that, we pulled together a fall planning committee. This was a committee that I tasked with pulling together everything we needed to do to operate with regard to our academic mission for this fall semester. This was led by an executive committee that was chaired by our provost. Marion Crane was serving as our interim provost, served until June 30th, and then she passed the baton to Beverly Wendland, who joined us as our provost on July 1st. Beverly comes to us from Johns Hopkins University, and she was actually involved in planning what was happening at Johns Hopkins and at WashU at the same time through the entirety of the spring. So there was an executive committee, and then there were 3 standards committees: a public health principles and community behavior committee, campus redesign, density, facilities, cleaning and building use, and a standards committee on communications and engagement. And then there were 4 working groups: monitoring and containment, student housing and dining, Danforth campus events, programming and public spaces, and of course our educational mission. Throughout the course of the summer, we had more than 150 participants serving on these committees and various subcommittees, faculty from all disciplines, staff with various different types of expertise. The fall plan that came out on July 31st, is what came out of these tireless 3 months of deliberation. Of course, we announced the plan on July 31st. That didn't end things. We continue to monitor the situation nationally at our peer institutions to see what's working and not. Every day seems to bring a new challenge and a new opportunity, and we've got to be ready to adjust at any moment. So before I close and turn things over to questions, let me take sort of a step up and talk briefly about what I see as the impact on higher education in general. So first, every college and university is in a unique position of financial stress. I will say that some institutions will not survive this pandemic, and I think for a whole host of reasons that's very unfortunate. Some will just not be able to make payroll and will have to close their doors. Those institutions are those that rely very heavily on tuition and auxiliary revenue. They've already had to make hard choices, and there will be harder choices to come. I think another implication with regard to higher education is the experience with online education is going to open all sorts of doors to innovation here at Washington University and elsewhere. For us, it's going to be innovating about how to use online tools within the context of residential undergraduate education. I also think that we have some real opportunities to innovate even more in exclusively online programs, especially at the graduate and professional level. You should know that we've been offering an online LLM degree in the law school for almost a decade now, and the Olin School of Business is about to launch a whole suite of online programs. I think there's a lot more that we can be doing in this space. As I think about American higher education more generally, I worry a lot about access. Of course, access is something that I've been talking about since I arrived back on campus as chancellor, which is simply how do we ensure that students with immense talent, but without the financial resources, how do we ensure that they're able to get a world-class education? And when I look at the system of higher education in the United States, I think that we're at a really troubling juncture. Our public universities are under a great deal of stress. Over the last 30 years, the amount of state support for public universities has been going down and down and down. And because every state needs to balance their budget, that funding, at least in the short term, is going to get even lower. I've also talked about the fact that many universities will ultimately fail, and that's going to reduce the seats available for students. Finally, I'm quite confident that we're going to see some universities to choose to reduce their financial aid budget. Why? Well, to balance their budget. But the side effect of that is quite consequential. And what I'm afraid of is that not over the next 10 or 20 years, but over the next 1 to 2 years, there will be fewer seats available for in-person residential undergraduate education, especially for students who rely on financial aid. And in my view, that is a great problem. It's also the case that Washington University is going to do our part to not be part of this trend. But of course, our student population is small, and the needs are enormous. I think another implication of this time is going to be an even greater demand for in-person residential undergraduate education. Those of you who are first-year students completed your high school studies online. For students who are returning, you got to see what a half of a semester in a completely remote fashion looks like. I think we all long for the days of being able to gather in community fully on our campuses. And I think that having this exposure to online education to even more and more students and prospective students is going to make the demand even greater. At the same time, we're going to need to be crisp about the value proposition. Why is it that a residential in-person education is better than just studying online? I do believe that there will be many other institutions who focus more on fully online undergraduate education. And over time, that folks will be able to get a bachelor's degree or the equivalent for very small amounts of money in an online format. I think that that's completely suitable for some students who are interested in some professions, but is not going to be a substitute for everyone. And I don't think is going to be able to replace the in-person residential experience that places like Washington University and our peers can deliver. Final thing I want to say about higher education, which is hard for people to wrap their minds around, is that universities are about much more than education, right? At times like these, and especially over the long term, I think the importance of the research that we're doing at places like Washington University will become more recognized. That includes, of course, the thing that's of the top of mind right now, COVID-19 research, vaccine development, therapeutics, clinical trials, and the development of testing capacity. but so too is the research on the health and economic disparities that the pandemic has caused, and the differential impact of the pandemic on various communities. Equally important is research on public policy and public administration, particularly when we're going to face some really challenging problems about vaccine allocation and skepticism about vaccines in the broader public. And of course, our colleagues in the humanities and the arts are doing research that help us to contextualize the pandemic in social and cultural context. Of course, it's not just COVID-19 research that's important. All of the research mission of the university is important, but I think this episode is going to bring into the public mind, focus the public mind on the importance of the research work that we do. And of course, at some universities like ours with academic medical centers, it's also the case that universities are oftentimes the leading healthcare providers in one community, as we are here in St. Louis. So just a few thoughts about what I view as the future of higher education more generally. I know that was a lot of information. My apologies for not having fancy slides. I'm now going to step back and ask Professor Milich to ask some of the questions that you all submitted earlier this week.
Thank you very much. That was wonderful. And you know, we've spent 3 weeks talking about this virus and the associated disease and everything that's happening in society. But obviously for these students, this is one of probably the most important thing right now for many of them. So I really appreciate you taking the time. We have a lot of questions, hundreds of questions from students. So I'm gonna jump around a little bit between different topics just to make sure that we can touch on some of the different topics that they're interested in. One thing that a student asked is about the testing, because in this course, we've talked a lot about the importance of testing. And so they were wondering if there are plans to utilize, which I think you talked about, the new test that was developed and approved by the FDA at WashU. Could you just tell us a little more about that and about the testing plans?
Yes, absolutely. So, you know, we rolled out, we've sort of rolled out over the last couple of weeks what those testing plans look like. We are indeed using the saliva-based test. In fact, we have first-year students who are arriving on the campus today who are stopping by a testing center on West Campus right now and utilizing that test. We are still, we are flexing our testing muscles with the saliva test over the next couple of weeks and increasing the testing capacity as we go. As we've announced, all of our residential students are being tested this week and next. Our graduate and professional students, as well as our undergraduate students living off the campus, are going to be tested in the following week or two. And then we're going to be doing every 2-week testing of all of our undergraduate students going forward. We also have a testing facility in UMRAF, which is open and available now. This is a testing facility for symptomatic individuals. And that's, of course, being managed by the HABIF Health Center. You know, we're working very closely with colleagues in the infectious disease department, in the Department of Medicine, along with folks at HABIF and our public health experts, to use that testing capacity that we have to support our mission, but also to support the mission of Washington, to support our mission in service of others. Yesterday, we met with Governor Parson of Missouri, Senator Blunt, who's our senior senator, to learn about what's happening more generally at the medical school, but also to talk about ways in which we can use that testing capacity to serve the St. Louis region in the state of Missouri. And so, as our testing capacity goes, we'll be using some of that capacity in support of that public mission as well.
That's great. Thank you. Another thing that we've talked about a lot in this class is this decision about schools opening or not opening. And we've talked about the reasons why it's not as simple as everyone stay home, because people don't have access to the same sorts of things. And of course, there's the concern of mental health and isolation also. And so there's a balance in making these decisions. The students are really interested in understanding more about some of the challenges that you faced in making the decision about students returning to campus.
Yeah, well, the biggest challenge, frankly, was working through all of the details. I mean, when I talk to students and their families, and as other universities did, beginning really in March and April, but certainly over the course of the summer, was really an overwhelming demand to come back to St. Louis and to be able to study here in some capacity. And so the biggest challenge, and this goes back to the early messaging all the way along, we didn't quite use this language, but how do we operate the educational mission of the Danforth campus given the constraint of COVID-19? And what made that hard, of course, is the nature of that constraint changed, right? Things were looking pretty rosy in June. Things were looking much different towards the end of July. And here we sit today, we're looking a little better, but still not nearly as good as we were in June, and we have a long way to go. And so balancing that has been, I think, was the most difficult part. I say the other thing is and your question, the question alludes to this. It's not really a dichotomy, right? It's not a dichotomy between virtual online education with students not in St. Louis or students in St. Louis taking classes. Right? One of the things that we learned, particularly with the housing situation, which was sorted out that first week in August, we needed to de-densify our dorms. We needed to do that in order to have isolation and quarantine space, and also to ensure that all of our students were in singles, something that our public health experts thought was very important. One of the things that we realized, which is kind of obvious if you think about it now, but it wasn't obvious at the time, is how many students were choosing to come back to St. Louis regardless of what we did, right? And so the choice of whether to be fully remote or not actually is related to, but only loosely related to whether students were going to be here in St. Louis. And so as we continue to think and monitor, we sort of viewed are we going to go fully remote or not to be a bit of a false choice. Really to think about how do we manage under constraint, how do we create a campus environment that's going to promote healthy interaction among students, faculty, and staff, given this constraint that we're operating under.
Yep. Yeah, that makes sense. And so related to that, when we think back, if we can even remember back when this first started and you had to make the decision about shutting down campus, what was going through your head at that point?
Well, that's a tough question. I mean, it's kind of a fog of war question. I certainly remember. I certainly remember what was happening that weekend. Lots and lots of conversations with my leadership team, with the leadership of the medical school, public health and infectious disease colleagues. And, at the time, things were beginning to get bad in New York. Things were beginning to get bad in the Bay Area. But we had one case in Missouri. And we had actually dealt with a situation where we had a group of doctors who were at an academic conference and had come home, and a significant fraction of them came home positive, which actually had some implications for us in terms of being able to deliver healthcare in that department. But that experience, and then seeing what was happening in other cities, and then realizing that we have thousands and thousands of students, many of whom are in the places where there is known community spread. It just was like, all right, we've got to do this. And then the gravity of that sunk in. Like, we're going to be telling people who hadn't planned this that they can't come back here, that they need to figure out how to get from their spring break location back to their residence. We got to figure out how to get them their stuff. It became obvious to me at that point that commencement wasn't going to happen, that our seniors in particular were going to lose like a really great 2 months at the end of one senior year of college. And so, for me personally, it was, the intensity of very difficult decision making at a very complicated point in time with good information, but also limited information. And at the same time, the emotional state of recognizing, wow, we're going to profoundly affect every one of our students. We are profoundly changing the nature of work for our faculty and for our staff. And at the same time, I was also involved in all the decision making at the medical school. How are we going to prepare this group of faculty, these physicians, scientists, and everyone who supports them. How are we going to work together with BJC to be able to deliver on that healthcare mission? And I was doing that all at the same time, and so it was complicated.
Yeah, absolutely. I believe it. I was actually supposed to be in Italy at that time and didn't go because obviously Italy had issues prior to us realizing how it would be here. And so I was in my lab doing lab work that whole week and just kind of seeing the campus get gradually more and more thinned out. Yeah, so, okay. Then in coming back to this moment now, when we're thinking about how to plan out the fall and you know, taking these extra weeks to make plans, to what extent is what's happening on other campuses playing into how you're planning out or changing the plan for our campus? And some students are also wondering if for the schools on our campus that are already open, have you seen anything come out of that slow opening that has now made you rethink or change plans for opening the additional schools?
No. So what we've seen in the first 2 weeks at the Brown School and the law school has made me even more comfortable, more confident with the way in which we're handling getting students in and out of classrooms, the social distancing that's happening in the classrooms, the masking, and all of those sorts of things. I mean, I'm going to be teaching in person beginning a week from Wednesday. It's my first class, and you know, that is a very low risk environment, and one that I think that we should all be, you know, quite comfortable with. Look, the things that we're learning from other campuses is that the biggest problem that we're seeing on other campuses are large events, typically parties, where big groups of unmasked people are getting together in you know, closely together outdoors, or even worse, indoors. You know, that's what we're seeing on other campuses. Now, I think it's also important to note that we're not seeing that on every campus. I mean, those are the headline making stories. I sure hope that Washington University isn't one of those headline making campuses. But that's the place where we're seeing, you know, really significant things. And of course, that's affected to some extent how we're communicating with students. But at the end of the day, and I'll speak to the 700 or so folks who are on right now, you know, this is our collective responsibility. You know, we can come back to campus, we can have a good time, but maybe not in the same way that we've had good times in the past. You know, we're certainly going to be here to support you all the way through your educational mission, to provide you with the tools you need for your health and wellness and so forth. But, you know, we've got to do this together. And as long as we make collectively the right choices, you know, this is going to be a completely weird semester, but one that we're going to be able to navigate.
Excellent. That's something that we talk about in this class all the time, and also creating a community among ourselves so that we can be practicing these safe behaviors.
And we as a community can look and see what's happened on some of these other campuses and be really intentional about, okay, we can make choices such that doesn't happen here.
Yeah, absolutely. And I do want to note, we are down a few hundred students today because they're actually moving in. So today is their move-in day, exactly.
That's great.
But they'll watch it afterwards because we're recording. So actually, just related to what you mentioned, one of the students asked very specifically how WashU is going to ensure that students follow guidelines. I mean, obviously, we're trying our best to get that to be part of the culture on campus, but is there anything in addition to that WashU will be doing, and in what way will WashU do things differently to avoid falling into the same patterns like you were just talking about on these other campuses?
Well, you know, the places where the places that we can control or at least have greater influence are in our facilities. So the South 40, the North Side, obviously the classroom buildings and so forth on the Danforth campus. And, you know, we've done a lot to create environments that are going to be conducive to healthier modes of interaction. I mean, and that includes, you know, the tents that we have all around campus. I think we're dropping over 1,000 seats that are going to be available outdoors on the Danforth campus to just be able to sit down and outdoors and so forth. So we're doing a lot there. I mean, how do we ensure? We can't ensure. right? I think, and that's the, I mean, look, if we could insure, then this would be a piece of cake, right? But we can't insure. And so, you know, the approach that we're taking is one that's focused on community, that's focused on collective responsibility, and really getting back to the values that we have as a community. I mean, if you think about it, you know, everybody's here to get an education, and we can make choices that are going to change the way in which others are going to get education, right? And so, you know, we're going to continue to do what we can, but you know, we're not Big Brother. We're not, you know, we're not out patrolling. You know, we will use some tools that we have at our disposal, but at the end of the day, this is something that's got to be community done and community reinforced.
Absolutely. And I have to tell you that the students in this class are phenomenal. And just if you have a chance to read any of their comments or see any of their public communications, they will give you hope, because I think that they really are doing work to make our campus a safer place, which is great. But even with that, even if everyone tries very hard, the students are wondering, is there a tipping point? If things get to a certain level nationally or in Missouri or on campus, is there a point in which campus may shut down this fall?
Sure. I mean, I could certainly imagine scenarios where we would have to pivot operations. I don't think I'd necessarily use the word shut down, because I would say that shut down is something that's it's very hard to define. You know, I mean, we of course shut down in March, but we actually didn't shut down. We had hundreds of students who lived in the dormitories, some until May or June. As a matter of fact, and so we were, you know, feeding them and and so on and so forth. And there were parts of research that continued and whatnot. I've had a lot of folks who have asked, "What's the algorithm?" Like, just tell me, what are the metrics so we know exactly what's going to happen. And this is a situation where there isn't a set of metrics. You know, we have a number of things that we're looking at. We're certainly going to be looking at what we see from testing. We're going to be looking at positivity on our campus and in the region. We're going to look at the ability for us to manage the demands on the healthcare system. Our campus healthcare system, so isolation, quarantine, housing, which is managed out of HABIF, which we have staffed up tremendously. In anticipation of greater demands. I mean, you know, look, typically, you know how many students we have in isolation and quarantine housing? 0, right? And so we have to have a team of people who are going to be prepared, a team of people to be prepared to deal with that. Again, you know, we're going to do our best to operate under the constraint that we're given. We are going to continue to look at things in a holistic way. And if we need to adjust in some fashion, we'll make the adjustment. But it's not formulaic, and it's something that's being monitored really on a daily basis.
That's great. So I want to shift gears a little bit and ask you, a lot of the students are interested. We hear a lot about the CARES Act. We've heard about it in this class. And so some of the students are asking about, they've heard that WashU turned down the CARES Act funding, and they were wondering why that was and what are some of the regulatory liabilities.
Sure. So in the I guess it's still the first CARES Act, and in the CARES Act that was initially passed, Washington University was given the opportunity to receive two pots of money in 2 different parts of the bill. One had to do with healthcare provision, and we accepted those funds, and there was another tranche of money that came at the very end of June as well, that came to hospitals, faculty practices, and the like. And so we did accept that money. We were allocated $6.4 million in CARES Act funding, half of which was to be spent on our students. We ultimately chose not to take that money for one reason. The CARES Act stipulated that in order to take that money, you needed to keep your payroll up to the greatest extent practicable. And we had furloughed 2,000 employees. And so we felt that there was significant risk to taking that money given the personnel moves that we needed to make. Now, I should note, of those furloughs, about 65% were at the medical school. We're not at the Danforth campus. But were necessary in order to manage that budget shortfall that we were dealing with in April, May, and June. And so that's ultimately why we didn't take those money. I made the commitment to my board at that time, and we've certainly met that commitment, that everything we would have done if we had gotten that $6.4 million, we went ahead and did anyway, right? And those are going into those two one-time, call them buckets, but the one-time non-recurring expenses for COVID-19, the $25 million for fiscal 20 and the $48 million for fiscal 21. I mean, a lot of those resources that we would have deployed had we gotten the CARES Act. We've done exactly the same thing with resources that we're still trying to figure out exactly how we're going to pay for. One example has to do with laptop provision. I think we've purchased 1,200, 1,500 laptops, which are going to be made available to undergraduate students who have need-based financial aid. Why is that? Well, one of the things we learned this spring is that you need to have a newish laptop in order to be able to most effectively interact in a Zoom environment. And so, those are the sorts of things that we've done anyway, but that's the reason why we didn't take the CARES Act money.
Yeah, and that's such an important point, because as someone who was teaching in the spring and now is teaching again, students having access to reliable devices is so important for being able to do this well. So I'm super glad the university did that. Students are interested in your opinion on this, I think because of your work with constitutional law. They were wondering, how do you think policymakers should go about balancing concerns for public health and respect of individual freedoms?
So I think that's a great question. And if you look, as you sort of take a step back and look at the way in which COVID-19 has been politicized to some extent, some places more than others, some levels of government more than others, that's the fundamental tension. And that tension between individual rights and public health, which is by definition a collective thing. How is this going to play out? I'm hopeful that on the other side of this pandemic, assuming we see the other side of this pandemic, that at the federal level, we'll be able to have a real rigorous debate about public health and public health infrastructure in the United States. Federalism has all sorts of wonderful advantages. It allows states to innovate. It allows there to be different public policy in different parts of the country, given different geography and population and economy and so on. So federalism can be a really great thing. Federalism is lousy when you have something that doesn't respect state borders like a virus. And as a country, we've divested from our public health infrastructure. I think that there's some concern that some of our institutions have become politicized. And as a country, I think we really need to grapple with that fundamental tension between individual rights and collective public health, to have some clear guidance and to have ultimately some legislation that's going to provide guidance for future administrations when they have to deal with this type of situation. I think that work has to happen in the legislative branch. Right, this can't be done with executive order, right? It has to come out of the democratic branches. Of course, the courts are going to need to be involved, and various things are going to be tested, in the courts. But it would sure be great for us to handle this ex ante as opposed to ex post, such that the next time something like this happens, we're going to be able to mobilize and move forward.
Absolutely, yeah, and even now, as we can pick up new things to do that help us, that's all the better for us. So you mentioned when we're on the other side of this pandemic, and every speaker has come up with a new term to try and figure out what we call it. Students are wondering.
Hopefully 2021. Sorry.
That's right. Absolutely. So students are wondering, you mentioned a few things that may change permanently within higher education. They're just wondering if there are specific things that you think would be good policies or activities that we could keep around after that should really become a part of our normal operation.
Sure, I think yeah, I can think of a couple. One, I think that we're going to see people not come to class and not come to work when they're sick. This is something that had really become normative. I can remember walking into classroom and having a quarter of my students in looking like a bit of a mess because they've got a cold or something else. And I think that we're going to see a lot more. I think we're going to see a lot more sensitivity around this going forward. It's going to be normatively okay. I mean, in the past, it's always been like, yeah, I'm going to be this big tough person, and I'm going to show up to work no matter how sick I am, and like that's nuts. And I think that's, and look, and I've caught the flu the last 2 winters, even though I had a flu shot, partly because I'm out, at big events and shaking hands and meeting a lot of people. I'm hopeful that will change going forward. I think that one thing that's going to be huge from an operational side, which I think has huge implications for our spaces. Washington University has had a very conservative set of human resources policies. There's like a fixed work day. There's no flex time. You can't work at home. I mean, faculty have more flexibility, but our staff certainly don't. And I think going forward that there's going to be a lot more flexibility, recognizing that people, have very different obligations and so forth. We're going to see more people working from home, and for some people who like that, that's a really positive thing. But, we're going to need to sort out what that balance looks like. But one of the things I think it means in the long term is that we're going to have a lot more space available on our campus. And of course, one of the things that I've heard a lot from our undergraduate students over the last couple of years has to do with the lack of space that we have, particularly for certain student groups who are interested in certain types of activities. And over time, we're going to be able, I believe, to reprogram some space that had typically been used, 9 to 5 for people to work in, to work differently. I think this video conferencing that we're all doing all the time and is driving us nuts at the moment is something that's going to be part of our repertoire. I saw something recently. It was like, our children are never going to know what it's like to have a snow day because you can just get on Zoom and go to class. I'm not sure. I think we have some interesting choices to make about our education policies. The arts and sciences faculty in particular are going to have, I'm sure, a very interesting and robust discussion in the year to come about the role of technology and so forth. But us having used this Zoom technology as much as we have and other platforms as well, I think there's going to be a lot more things where it's just going to be much easier to pull together meetings. And certainly as I think about my life, where I'm bouncing between the Danforth campus and the medical campus sometimes multiple times a day, that this will make it, make things a little bit easier, I think, at the margin.
That's good. I want to ask you, do you have time for me to ask you just 2 more questions?
Sure.
Okay, great. So I think that exactly what you're talking about, the Zooming, working from home, those sorts of things, we have had a collide between our professional life and our personal life, at least I have as a professor. And so I was wondering if you could talk about, and I think that you could attack this from both sides, both the professional side and personal side. What has been the biggest challenge that you've faced during this pandemic?
I mean, look, the biggest challenge that I've faced is that there's been absolutely no separation between my professional and personal life. That's partly because I live here on Harbison House on campus. It's also the case that my office is off of my bedroom. So I'm in the same space. I'm down in the dining room today, but I'm in the same space 22, 23 hours a day. I'm also a husband and a dad. My daughter Olive is 12 years old. She was, her school shut at the, after her spring break in March. And so she was here, and it's one of the things that she joked about is like, Dad, this is the worst time ever to be an only child, which is, I think, probably true. But for me, particularly during March and through much of April, when there was so much intensity that the workday was starting before I woke up, and I was on calls until 9, 10, 11 o'clock at night, every night, 7 days a week. It was hard to sort of get away and be able to have some time for myself and some time for my family. Now, I think by the end of April, by May, things had gotten a little bit better, but that was certainly the biggest challenge that I was dealing with.
Yeah, and I think that it's good for students to hear, that at every level we're dealing with these challenges. And so one theme of this class is just continue to show each other kindness and empathy and be gentle with each other, which I think is good for us to always reiterate. So this has been really wonderful. My last question for you is just if there are any last words of advice or wisdom that you'd like to tell the students before you go.
I don't know if I have any wisdom, but I can say that I've always been so deeply impressed by the quality of the students that we have here at Washington University. And to see 1,300 students who decide they want to focus their brains on this pandemic through this class is something that really, that I found to be really inspirational. And really inspirational because it's about the mission, right? This is an example of using our education mission to help not only contextualize and understand what it is that's happening in our world today, but also to use that mission to hopefully uplift the rest of our mission, to bring together community, to work together, to grapple with this. I just want the students to know how happy I am that we're back together. I know some of you are going to be with us just virtually this fall, but I'm glad that you'll be able to have that experience. And for those of you coming back to St. Louis, for those of you who are back in St. Louis, welcome back. I look forward to seeing you in masked and distanced ways, and wish you all nothing but the best in the fall semester.
Thank you very much for being here. I really appreciate it.
My pleasure. Thanks to you for your leadership.
Thank you. Bye.
All right, take care.
Thank you. Okay, so we are going to shift gears now to our last hour of class, if you can believe it. We have reached the end of this 30-hour endeavor together. Oh, and still we have things to learn. Megan, can you please give me the option to share my slides? Oh wait, I have it. Okay, great. Good. It wouldn't be the last class if I didn't have a technical issue, I think. Okay, wonderful. So in these last 40 minutes or so, I just want to talk to you about what we've gone through together in this class, kind of put together some final thoughts, and then also look to the future and think about where we're going from here, particularly as many of you are currently moving in and we're planning our fall together. So one thing I want to reiterate over and over again in this class is that the COVID-19 pandemic is a very serious concern for all of us. Although we were all dealing with it in different ways and we have different considerations, there is no denial that this has severely impacted our world and our country. So I pulled together these graphs and numbers from the first day of our class, August 17th, if you can remember that, just a few weeks ago, to today, September 4th. And so on the top here, we have, if I can, yep. So this is worldwide. I'm going to take you through a few of these slides so that you can see how things have changed. This is less than a 3-week period of time, right? We've been in a 3-week class. This is from the first Monday to the last Friday. And on that first day of class, we were at 21.7 million cases worldwide and over 775,000 deaths worldwide. In just a short 3 weeks, we have already gone up by 4.6 million new cases and over 93,000 more deaths. So we're now at 26.3 million cases worldwide and 868, almost 869 deaths worldwide. So we are continuing to suffer from this pandemic. It is a very serious concern. It is not something that we can say isn't happening. Within the United States in particular, we have struggled. We lead the world, as we like to do, in number of cases and number of deaths. On August 17th, there were 5.4 million cases in the United States and about 170,000 deaths. And now, less than 3 weeks later, we have over 700,000 new cases and almost 17,000 more deaths. So we're now at 6.1 million cases and almost 87,000 deaths. So this is impacting our globe. This is impacting our country. And it is also impacting Missouri. Here in Missouri, for those of you who are coming back to campus, on the first day of this class, on August 17th, we were at 68,000 cases and about 1,500 deaths. We now have 22,000 more cases than we did 3 weeks ago and 247 more deaths. And this is for, of course, just Missouri, right? Just one state within our country. So again, at a global, national, and state level, we are seeing increases in the number of cases and the number of deaths. We have certainly not dealt with this pandemic. We are not in the clear. We don't have high herd immunity. We are struggling, and it is up to all of us, as we've discussed in this class, to try to do what we can to stop this pandemic. And as so many speakers have said, if you want to help out with any of the societal problems that are being exacerbated by this pandemic, the most important thing you can do is work to end the pandemic. So let's talk about all of those lessons that we learned in this class. I want to go through what we've learned, what we can do, and where we go from here. So let's start with what we've learned about SARS-CoV-2. We learned that it's a novel coronavirus to humans, and it's associated with severe acute respiratory syndrome. We have also learned that a very important factor for SARS-CoV-2 is the fact that there is a lot of asymptomatic spread. This is different than what we saw with other coronavirus outbreaks. It also has a relatively long incubation time. That means that people that can spread it when they're pre-symptomatic or asymptomatic have an extended period of time before they might know that they have the illness. We also learned about the ways that it can spread. So person to person through droplets, also through aerosol transmission, and also through fomite transmission, which means, of course, touching an object that's contaminated and then touching your face. Remember, don't touch your face. We also learned that the spread can be controlled by safety measures and behavioral adjustments when those are possible. And as we heard from many people, there is still a lot that we do not know about this virus. And so there is still a lot that we need to learn in order for us to have the answers that we need for dealing with this virus. And importantly, the difference between SARS-CoV-2 and COVID-19 is that SARS-CoV-2 is the virus that causes the disease COVID-19. So let's talk about COVID-19. What have we learned about it? Well, it is now a leading cause of death in the United States. So again, this is a very serious illness that we need to be proactive about dealing with. It also varies in severity from mild to deadly. There are some people who have very mild illness for COVID-19 and also a lot of people who die from it. And in between these two, there's a lot of variation. So it can cause extended illness in some patients. And the extent of that and what that means for them is still unknown. So we do not yet know the long-term effects of people who have been infected with SARS-CoV-2 and suffered from COVID-19. We know that there is currently no vaccine, and as we've discussed in this class many times, the timeline for making a vaccine is often very long, very, very long, and there are certain parts of that timeline that we can make more efficient and speed up. So things like getting the funding needed to create the vaccine, or getting the FDA to look at it more quickly and test it. But there are other aspects of vaccine development that we can't control, and that includes finding one that's efficient, finding one that doesn't have side effects. And so we want to make sure that all of the support that is necessary is going towards people who are working on vaccines and other treatment options, but we also have to be realistic about doing our part to try and stop the spread until those are available, because we know that it takes a long time. And we also know that treatment options right now are limited. And that, again, makes this disease something very difficult to deal with. In severe cases, we have some medical intervention, particularly the use of ventilators, that can be life-saving. And so it's important that people who need access to hospitals have access to hospitals. But of course, we also know that hospitals do not have the necessary ventilators, beds, or other medical equipment that's needed to handle surges in COVID-19 cases. And that in addition to that, because they can't handle all of those patients, they are starting to make really difficult decisions about what other patients they're able to accept and which ones they aren't. And that means people who are suffering from other illnesses are not getting the medical attention that they need. This, of course, is a huge concern and has cascading effects. We also know that healthcare workers do not have the personal protective equipment or the support that they need to handle surges in cases. So not only do we not have the equipment, we don't have the safety materials, and also we don't have enough support for hospitals to be handling these extreme number of cases that have happened in some places. Because of that, it means that the negative effects of this disease are exponential. We also know that testing and tracing are an important public health practice that is definitely important for controlling the number of cases of COVID-19 and dealing with finding cases of positive samples and dealing with those cases. Unfortunately, the United States right now does not have a cohesive testing and tracing plan, and that has also caused problems. We know that there should be adequate information that's provided with testing results. We've talked about a lot of this. So part of it is understanding that biomedical tests have false results. So you need to be educating patients when they're receiving their test results on what they mean. And in addition to the fact that your test results may be wrong, it is also the case that even if your test is truly negative, you could walk out the door and encounter COVID-19. So you can't just say, I have a negative test, I don't need to take any of these safety precautions. We need to be providing patients with adequate information about what they need to do with their test results, what that actually means. And then we also have to be providing them with support. We talked about mental health, having someone there who can talk to them about their mental health if they're receiving upsetting results, which in this case would be positive results. And then also the fact that if we're going to use those positive test results to advocate for isolation or quarantine, we need to have social systems in place to support people who are isolated or in quarantine. We also talked about how important leadership is in managing a public health crisis and how we need clear and strong leadership to make sure that what needs done is done so that we can effectively deal with this pandemic. That has been seen in other countries. So we have some countries that through different measures, as Ed Young mentioned, none of them followed the same playbook, let's say, but through different measures, there are countries who have managed to control the outbreak in their countries. Some countries have significantly reduced the spread of the virus and minimized the number of deaths from COVID-19 through leadership, through testing and tracing, through behavioral measures that reduce the spread of the virus, and doing it without a vaccine and without any additional treatment beyond what we have. But the United States, unfortunately, has missed some critical steps in curbing the spread of SARS-CoV-2, and that is what has led us here, right? So on our report card, Right now, we have an improve in all areas. And the good news is that in this class, we've talked so much about all of those different areas that we can improve in. And so we can start to work and raise awareness so that hopefully the United States can become one of these countries that adequately deals with the pandemic. One of those steps is communicating accurate science and health information to the public. This is important to improve the response. There's been a lot of misinformation. We learned that the exponential growth of COVID-19 cases are hard for the human brain to process. And so even if we're telling people, look at this graph, this is growing really quickly and it's going to keep growing. Every one person infected is going to infect 7 others. It's hard for our brain to process that information. To effectively understand the information and use it, we had our speakers talk to us about slowing down and examining our thinking, really taking time to examine the information that we're given and hopefully come up with a better plan for moving forward. So let's talk about what we learned about communication. Communicating accurate science and health information to the public is part of an improved response. We learned that we should never underestimate our audience. So saying things like, we need to dumb it down for the audience, that was a big no-no, right? You want to remember that your audience is capable of receiving information if you're able to explain it to them. So think about how you're communicating that and how you can get your message across. Part of this is also that we should make our audience want to engage with our message. So if we create a divide between us and our audience and we make them not want to look at the messages that we're communicating, then we'll never be effective communicators. So we want to make sure that we're trying to make the information that we're sharing accessible. We make it so that they are able to understand what we're saying and that they want to understand what we're saying. And this means getting creative. And I have seen so many of you do that, and I am so happy about that. I think that I will spend the rest of this pandemic catching up on the hashtag COVID course posts because I haven't had much time, as you may imagine, while teaching all of you. But when I have seen posts, it amazes me. The videos, the websites, the letters to editors, the infographics. You all have done an incredible job creating communication pieces that hopefully reach your communities. I've seen these communication pieces in a number of different languages. I think that it's wonderful how you are trying to help increase the awareness of this pandemic and find ways to really effectively communicate. And I'm glad that with this class, you've received some messages about how to do that more effectively. Okay, so this includes visuals, written materials, interactive features, audio engagement, and more. And of course, with those communication pieces, we're trying to deal with this issue of misinformation that has been a topic in this course and also a topic within the pandemic response in the United States at large. So I want to encourage you and remind you that you can use the tools that you learned in this class to examine and critique information from the news and also from scientific sources. So for example, we walked through how you can look at a scientific paper and critique research findings. Of course, in the abstract, sometimes authors say very grand things, but you need to actually look at how they did that research, what their results were, and then what conclusions they're jumping to from those results. You want to examine the assumptions that they have and also really investigate if their conclusions are supported by the results that they found. Because as with the example that we went over in this class, often the conclusions do not match what the data show. And it's so important to be clear about that because we don't want to say, Here's a scientific paper that's cited over 2,000 times. It must be reliable. I'm going to read the abstract and then base my decisions off of that. That's not how we stay informed, and that's not how we can prevent misinformation. In the same way, you should be able to examine the data for claims you hear in the news. So I also gave you an example of that in this class based on some of the questions that we had been receiving in the question box. I took one of these questions and I pulled up graphics and looked at the comparison between the actual case numbers and what the question was assuming and thought was happening within our country, right? And so you can do the same thing. If you hear something on the news or someone tells you some fact that you think that doesn't seem right, you have the ability to investigate, especially now we've heard from people at many different universities who are providing data. We've talked about the CDC, which has data available. We've talked to people from the World Health Organization that has data available, from Johns Hopkins, which has that amazing dashboard that you can use to track information about the pandemic. So when you hear something about how no one's dying of COVID-19 anymore, for example, go to the dashboard, pull the data, use what you learned in this class to have an informed conversation about that misunderstanding. So keep in mind that you have the tools to identify and combat misinformation, and I really want you to feel empowered to do that. I know that this was a 3-week course and that we covered a lot of information that you may feel like you didn't totally understand all of it, but I think you probably understood more than you realize, and I want you to feel empowered to spread the information that you've learned. Okay, what have we learned about society? So we learned about the virus, we learned about SARS-CoV-2, we learned about COVID-19, the resulting disease. We learned about the pandemic, how it's affecting the world, how it looks in our country versus other countries. And we also talked about communication and misinformation. But importantly, the second half of the subtitle of this course is society. So what have we learned about the impact of COVID-19 on society? Contrary to what was being said at the beginning of this pandemic, COVID-19 is not the great equalizer. It actually exacerbates existing disparities within our society. So there are disparities that exist across the board in our society, and we have seen how COVID-19 further exacerbates these in so many ways: at home, for children, for working families, for the homeless community, for healthcare workers. Across the board, we're seeing that we just further are exacerbating existing disparities within our society. Specifically, we've talked about racial health disparities, the generational wealth gap, ableist policies, language barriers, gender inequality, LGBTQ+ concerns, and so much more. And importantly, we've noted that Black, Latinx, and American Indian and Alaska Native people are disproportionately impacted by COVID-19. We've seen these numbers from multiple guests for different communities. In addition to that, we've seen that individuals making less than $25,000 a year, or low wage, people working in low wage jobs, individuals who are deemed essential, individuals who are unable to work from home, and then those that are in jobs with unemployment and leave benefits, so things like sick leave or family leave, those individuals are disproportionately impacted as well. To add to this, there is a significant amount of overlap between the people that make up these two bullet points, right? So we need to be concerned about both of those bullet points individually. That's very important. And then we also need to be concerned about the overlap of that, because that means that there are compounding impacts on certain groups within our society. In addition to that, we have these existing societal issues like homelessness, intimate partner violence or domestic violence, and mass incarceration that are exacerbated by COVID-19. So we have societal issues, we have particular groups within our societies that are dealing with different issues and differentially impacted by this pandemic. We've also seen how child development and support for working families is complicated by this pandemic. And again, you have this overlap, right, between the essential worker, for example, and childcare, or between families that are within a lower income bracket and dealing with working families and childcare. So all of these things are really compiling to make this very complicated situation in which we have a lot of variation about how the pandemic is affecting different people in our society. In addition to all of this, as these added stressors are just building up more and more, we've been cut off from each other. So all of the things that we would normally do to help develop our own feelings of empathy and also provide for each other, we aren't able to do them because of the safety concerns and the need to distance and be careful about spreading the virus. So we've been cut off from each other and from those things that help us develop empathy. And that empathy is really key to dealing with this pandemic together. I hope that in this class, we've helped you to touch base a little more with that feeling of empathy and with that need for empathy in how we handle this pandemic. And I'm going to talk a little bit more about that later in the lecture. We also learned about words and that words matter. This is true in so many ways, and we've heard this from multiple speakers, that the words we use are important because they affect how we treat each other. They also affect how we try and deal with the issue at hand. One thing that we can do related to our words is try and normalize testing. Normalize testing and also not stigmatize illness. We should not attach stigma to illness. We want to remember to show kindness to each other and to be gentle with each other. We also want to make sure that we're recognizing our own role in this pandemic rather than focusing on the other or placing blame. Of course, individuals, we want to work together as a collective to try and solve this issue, but of course there's a lot of variation in how able people are to do that. And so we want to be understanding of that as well, right? So it's really about how much each of us can do to try and do the best that we can within our own circumstances, knowing that not everyone is in the same circumstance as us. So make sure that you keep that in mind. I don't like blanket statements. I don't think we should be making blanket statements. And I know that I started this course with that, so I'll also include it on the last lecture. Everyone is dealing with different situations. And so we really want to do our best within what we have control over to try and stop this pandemic and recognize that not everyone has the same advantages that we have. I think also with this it's so important for us to take responsibility for our actions for this pandemic and future pandemics, as we talked about these issues with human activity and how that leads to the destruction of the environment that puts humans and non-human animals in intimate contact, which can lead to zoonotic disease transmission. And I think I'm going to be getting to that in a few points. We should also make sure that we are supporting each other. We can and we should support each other. And again, we can do that through our words, through the language that we're choosing to use. So words are important in showing each other kindness, in being gentle with each other, in showing each other care, reducing stigma, normalizing things that need to be normalized within this pandemic. But words are also really important in making sure that we're communicating the right information. So as I mentioned, the causes of zoonotic disease transmission are human activity. right? Those words are important. Placing the blame on a certain animal, let's say the bat. I know a lot of people have really clung to this idea of the bat as the evil actor in this. That's not what we should be so concerned about, because as we look from the past of all of this different zoonotic transmission, we see that it happens from farm animals. It happens on different continents. It happens from different species. It happens as the result of climate change, as the result of habitat destruction, as the result of so many practices where we are creating a situation in which we are changing the natural environment, and that is having an effect on our world that increases the rates of zoonotic disease transmission and increases the likelihood of a pandemic. And once we have that pandemic, we need to be clear about the words we use for the sorts of struggles we are seeing. And the biggest one that has been talked about in the news in the United States are these economic issues. And it's set up as this dichotomy: do we need to be concerned about the economic issues from the lockdowns, or do we need to be concerned about the health of people who are sick with this illness? And in fact, that's a problematic question because it isn't broken down that way. We saw data that shows that the economic issues are actually because of the virus itself, not the lockdowns. And so we want to be very careful with our wording so that we are attacking the right issue rather than one that won't help us. We saw that in other countries where they chose not to shut down, they chose not to focus on the health of their citizens, and so they had large numbers of people get infected and die, and they also suffered economically. So our words matter, and we want to be very specific about what our concerns are and how we can handle them. So with that, I also want to talk about what we've learned that we can do to help with this pandemic. And I am keeping an eye on the questions, though there are a lot of them. So we'll see what we get to at the end. As I said at the beginning, in the middle, and now I will say it again at the end, make sure that you are washing your hands. And also, if you are able, please be sure to wear a mask. Amblehead doesn't wear a mask, but she does like to dig her head in things. So here she is, burying her nose in a blanket. Make sure that you keep your distance. Sorry, I'm having Zoom issues. When you can, get outside if you can. Like Amblehead here, who's enjoying the outdoors. And if you're able, vote. As we've seen so many times with everything that we've talked about, there are policies in place, there are issues that are happening that are being decided at the state, local, and national level, and you can use the information that you've learned in this class to look up certain policies that you're interested in, find the candidates that you want to vote for, and then go out and vote. And I also want to say at this point, keep in mind that voting this year is not going to be like other years. It's not going to be easy. You can't roll out of bed, walk to your polling station, and get a sticker. It's going to be complicated. So you want to think through your plan. What happens if you show up at your polling station and the line is 5 hours long? What are you going to do if you show up at the polling station and people aren't wearing masks and you don't feel comfortable staying there? Think ahead of time, come up with a plan, and then follow that plan. Voter turnout is so important, and you know, this year I think there are a lot of obstacles to being able to vote. So I hope that you all think about that ahead of time. Okay. Also, of course, as we've talked about so much in this class, with ourselves, we need to try and do as many of these personal behavioral changes that take into account these safety measures as we can, because we don't know what other people are going through. And because of that, we need to be considerate of the fact that everyone is dealing with different things in this pandemic. Yes, we're all going through this pandemic, but we are all dealing with different issues. And you can see here's just a sad day for Amblehead, where she's moping about So keep in mind that people are dealing with different issues. Apologies, okay. And be kind, be gentle, and try and cultivate empathy when you can. Also, you should think about trying to check in with friends and family that you are concerned about or that you want to maintain a connection with, even if you can't physically see them. I also recommend finding ways to connect, even if it's with your dog or some other kind of pet. Remember that connection doesn't have to be unsafe. Professor Bennett, for example, talked to us about ways we can connect while still staying physically distant. So you can connect virtually, you can connect through the mail, you can connect outside distantly with masks on. There are different ways that you can find to connect. You just want to make sure that when you're making these plans, you communicate about the plan and you do something that you feel comfortable with. You should also make sure that you're taking care of your mental health. So rather than moping like she was in the chair, Amblehead looks pretty happy here. Make sure that you're doing those different things that Dr. Ennis talked about to check in on your mental health and try and make sure that not only are you staying physically healthy, but also you're staying mentally healthy. Part of that means also taking care of your body. And this is something Amblehead doesn't like. So you can tell that in this picture, she is not as happy as in the last one. But you know, showering, getting a bath, she has to do that. And so going through those routine things, making sure you're eating, making sure that you're drinking enough water, making sure that you're bathing, that you're getting out of bed every day. Those things are important, right? Having those routines that help us even as we're dealing with this really difficult pandemic, and show yourself kindness too. But at least in the case of Amblehead, every few weeks, she does have to get a bath and she doesn't like it, but it's good for her. One thing she does love though, and that you also can do during this pandemic, is make sure you're getting enough rest. The pandemic can be exhausting. Dealing with Zoom can be exhausting. Thinking about all the safety measures we have to have in mind can be exhausting. Dealing with the emotional toll of finding out that someone you know has gotten COVID-19 or has passed away from COVID-19, all of these things are really difficult. So, you know, be kind to yourself. You may feel exhausted at different points. And Amblehead strongly advocates for sleeping all the time, everywhere, if you can, but don't actually sleep all the time because that's just something that Amblehead does. Okay. Also, if there are things that you can celebrate, find ways to celebrate. I know that some of you know that Amblehead's birthday was during this course. And so she got all dressed up even though she had nowhere to go. And she made a little party for herself at home. And you know, you can do this too. There's been ways that people have done game nights on Zoom or thrown parties on Zoom. You can send each other gifts. You can go outside and do things. There are ways to celebrate in a safe way. And remember that that doesn't mean having a massive party. It doesn't mean having a tailgate with a bunch of friends. It means doing things in a safe way that actually follow the guidelines that we've talked about. And I think at least from Amblehead's perspective, this can be done quite successfully, have a real birthday rager, and then of course pass out because you had such a great time on your birthday and you love to sleep, so you sleep all the time everywhere. So as I mentioned, I think another thing that you want to keep in mind is finding ways to connect, and we want to help you do that. So as soon as this class ends at 3 o'clock today, we have a discussion board set up to open, and that discussion board has a few things in it that I hope will help. One, we want to start this conversation about how now that we've formed this community within this class, we can keep it going, moving forward. Some of you will be on campus, some of you will not. So I hope that you use that discussion board and the course in general as a way to connect with people that you can either socialize with on campus in a distant and safe outdoor setting, or that you can create a virtual community with. And continue to socialize even outside of this class in a virtual community. We also have some resources listed for those of you who want to get involved, or for those of you who are looking for resources for mental health. We've linked all of these resources at different points in the course within the resource section of Canvas, but we've laid out a few of them there so that you can use them. We want to hear from you about what you're planning to do to help with your own mental health during this fall, as well as what you're planning to do to try and stay connected to a community. And again, who that community is could be anybody, but I hope for those of you who are looking for a community of like-minded people that you use the opportunities you've had in this class to have discussions with each other and to learn things and bounce ideas off each other. Use this course as a way to build a community on campus or virtually off campus. In addition, on that discussion board, one of your classmates has come up with a form for you to do an art exchange. Remember that you don't have to be good at art. I'm a testament to this. You don't have to be good at art to do an art exchange. There's lots of different kinds of art, right? So writing, photography, many different things. And so I encourage you later today after this class to check out that discussion board. Again, that'll open up at 3. And we want to hear from you about what you'll be doing to protect your mental health, what you'll be doing to connect, and also encouraging you, if you're interested, to take part in that art exchange. That's completely separate from the course, so it's totally up to you if you want to do it or not. And then on the first day of class, we're planning to open up a discussion board that you can use if you'd like to, where you can just share with your classmates how it's going, what's it look like on campus, how are your classes going, how do you feel you're doing with the things that you learned in this class on campus. And again, that's totally optional. You don't have to engage in that discussion board if you don't want to, but we wanted it to be an option for you in case you were looking for more ways to interact with each other and for other people who have gone through this course, this intensive experience, and learned all of these things. So keep an eye out for those discussion boards. Also, I want to say about the discussion boards that I have not had a lot of time to engage with them yet, but I am planning to this weekend. In particular, I'm really looking forward to seeing your comments about things that we can do to try and improve the situation with the environment. And I plan on adding some comments there as well about things that I do. So I'm looking forward to us learning together on that. I also wanted to mention that throughout the resources that we have on Canvas, you can look for opportunities to do work with other groups and build a community in other groups as well, through volunteering and other work on the different areas that we've discussed in this class. There's lots of resources in Canvas, and of course, if you have an area of interest, several students have reached out to me with specific interests in specific areas. I'm always happy to connect you to people in those areas, so feel free to reach out and stay in touch. And I also want to just reiterate this quote from Dr. Robin Nelson from yesterday that I thought was so great. Be willing to ruin the party. I think that is a literal statement now. I think that previously when she's used it, it's been more theoretical, but I think now we literally need to be willing to ruin the party if we don't want to go to a big party in the middle of a global pandemic that is killing people. And I think that you should feel totally fine with doing that. And I think it's probably the cool thing to do anyway, although I know that you all know that I'm not cool, and so you're not taking cool advice from me. But I still think that you all could make it the cool thing to do, to just ruin the party and say, we're not going to do this because it's not safe, and we're going to find a better way to socialize. I also want to mention before we go that there are opportunities to help on campus, and in particular, Dean Smith asked me to share with you this opportunity, which is as a student health ambassador. So it says, put your knowledge to work keeping WashU safe this fall, recruiting sophomore through senior students studying in person. And then there's a link. We'll put this link also on our Canvas page. I want to just share with you a bit from the document that she sent me. It says student health ambassadors will circulate around the Danforth campus for the first 2 weeks of class and help build good habits of masking and physical distancing. An interest in public health is welcome, but not required. There's the link that you can go to for more information and also to apply. They are giving priority to applications that are received by Thursday, September 10th. So make sure that you get your application in. It is a paid position. It says that students will be paid $10 per hour, and that there will be a virtual check-in meeting on September 13th. So if you are interested in being a student health ambassador, I encourage you to check that out. Okay, so we have reached the end. We have 5 minutes left or so for questions. There's hundreds of them, so obviously I won't get to all of them, but I do just want to say thank you to all of you. This was a massive undertaking for me, and you have all made it such a delight. Really, some of you have sent me messages. I've also seen your comments on the discussion board. And I think that as exhausted as I am from running this huge course, it really touches my heart. I have never felt so hopeful. I am always impressed by WashU students. Since I arrived here 3 years ago, I have been constantly impressed with the things that you do and the people that you are. And I feel very lucky to get to engage with you. And this course has just blown it out of the water. And yes, I'm starting to cry, so get over it. But thank you. This has been really wonderful. And I wish that everyone in our country had the chance to interact with all of you and to see how amazing you are, so that they could also experience the hope that I have right now. So with that, I will just take a couple questions. A lot of comments about Amblehead, who is really great, and lots of nice, okay, these are just nice questions. So I think with that, I'll say this: you do still have a few assignments left. We have that discussion board open. I think Amblehead is gonna say bye to you now. And of course, you're always welcome to reach out to me. Oh, here she is. Okay, good. This is going well. Okay, so from me and Amblehead, we just want to say thank you very much for all of your content in this course and being such great students. Please keep up the great work this fall and spread the news, and of course, build this community together. Thank you all very much, and stay safe this fall.